I'm in the prime position to have the resources and be able to deal with it essentially and go to the right people. But I didn't even know where to go being in that position. So, how in the world are people not in the medical field able to navigate this?
You did not choose it. If you were to choose, you would never choose it. And it's not your fault. But it doesn't define you. We shouldn't allow others to tell us otherwise or dictate what we want to pursue.
Remember, representation matters. If you don't feel represented, and you have the capacity and the bandwidth to do it, be that representation. Open that door and pursue. It will be hard. I'm not gonna lie. I've had a hard time, in medicine, having one hand and being the first in my school to have a single hand and pursue medicine.
This is my personal experience of going through infertility and follicle simulation. Walking up the stairs to my apartment, which was on the third floor, almost caused me to topple over. It was really uncomfortable, especially as got closer to the date that we'd go in and remove the follicles.
Chronic illness will try to attack your confidence. You're already going to have your confidence attacked as a new clinician. You're already going to feel inadequate. You're already going to feel that you are absolutely just overwhelmed. It is really important to be grounded in why you joined this field.
Looking back, I now recognize that I had anxiety and depression, and combining that with the hard aspects of residency, the work hours, academic rigor, all those kinds of things, just created a very bad soup for me.
And significant lab abnormalities, like kidney failure. I think it was almost scarier to be a doctor in that standpoint because I saw my labs rolling in every morning and I knew kind of what that meant. And I also started to see like that interplay between doctor and patient.
I noticed then more than ever that I was getting distracted in the room with other students. And I asked the teacher, like, look, this isn't really working for me. Can I take the test in the room by myself? She allowed that to happen. So that was my first unofficial accommodations I got in learning.
One of the process of this journey for me was to find people with disabilities that had thought outside of the box and had to customize certain things that worked for them. And so I didn't need to reinvent the wheel.
There's something difficult about mental illness, which is that it's a reaction in your brain, the thing that you are also using for medical decision making. You have to work on parsing out those two things and how they interact with each other, and how controlling something like anxiety for me helps me also be a better doctor. When I'm working on my anxiety, I'm also being productive in being a better doctor.
You might feel like your problems don't matter, or as a clinician, you might listen to people who've had worse lives and think, my life isn't like that. I don't deserve that. And truthfully, the worst thing you're struggling from is your thing.
Having disability really helped me be more empathetic to patients and trying to understand where they're coming from, because I had hard times too, and there are doctors who help me even with the small concern. I want to be like one of them. We listen to people. I'm pretty good at attention to details, so it helps me do my job.
The very first time I took the MCAT, I had an anxiety attack. It always was these standardized exams that I really struggled with, and I thought it was just me not doing well in tests. But I always did well in school tests. That was maybe because there wasn't really a strong time limit. There was, like, you had to get it done in an hour or whatever at the time. I was always the last to finish, so I did definitely take longer on exams.
I had to break down the fear and shame and this belief that I didn't deserve pleasure, deserve to be pain-free. So that experience was the prelude to joining a community of other sex health advocates who've been through similar situations and are fighting to break down stigma.
Not believing what we call the arrival fallacy, which is thinking that once I become a doctor or once I become a clinic director, once I become whatever it may be, what your goal is, then I'll be happy. That just doesn't happen.
If you are pursuing medicine and you are entering this field as a Latino, as a minority, as a woman, wherever you come from, please remember that you do not have to shave away pieces of yourself to fit into the mold that society has told us is what a doctor looks like. A doctor looks like you. A doctor looks like me. Our patients need us. They're waiting for you. They're waiting for me. They need us now more than ever.